Caregivers, I need you to know something. Dementia is a disease. It is not a normal part of getting older. Let's learn a little more about it. Hello all, Jennifer here. Today we are cracking the code for types of dementia. According to the World Health Organization, an estimated 47.5 million people worldwide are living with dementia, and over 7 million new cases are diagnosed each year. Those are huge numbers, and that's why part of this channel was developed, because I know how impactful dementia can be and how much it can interrupt your life and make being a caregiver that much more difficult. So today I want to go over the 5 major types of dementia and explain the differences between each type. I'm going to run through these rather quickly, but I will attach a PDF copy in the description section below so you will have a reference to look back on. And don't hesitate to leave a comment and ask for more information on any of the types that I touch on today, or even the ones that I don't. So first, let's discuss what dementia is. Dementia is a progressive, meaning it gets worse over time, and chronic, meaning long-lasting, brain condition that causes problems with memory, thinking, and behavior. The first and most talked about dementia is Alzheimer's disease. Experts estimate that between 60 and 80% of people with dementia have this type. Alzheimer's presents itself with mild symptoms at first that get progressively worse over a number of years. You will start to notice symptoms such as memory loss, trouble planning, and doing familiar tasks first. Other symptoms to look out for include being confused about where they are or what year it is, having trouble speaking or writing, losing common items, showing poor judgment, and having mood swings or changes in their personality. The second most common type of dementia is called vascular dementia. And strokes are the most common cause of this type, but they're not always the cause. The symptoms of vascular dementia are going to depend on which part of the brain was affected. However, unlike Alzheimer's disease, where you may start to notice memory problems first, vascular dementia usually begins with poor judgment and difficulty planning and making decisions. Other major signs to look out for with this type also include trouble speaking or understanding others, problems recognizing sights and sounds that used to be very familiar, memory problems, increased confusion and agitation, problems walking, and having frequent falls. Now, next on the list is Lewy body dementia. This type of dementia is probably the one that is closest to my heart because this is the one that I dealt with my grandmother. Lewy body dementia was discovered by a doctor named Frederick Lewy. He was a German neurologist, and he discovered that tiny abnormal deposits of a protein, he named Lewy bodies, developed in nerve cells and disrupt the brain's normal functioning. Now, Lewy body dementia shares symptoms with both Alzheimer's and Parkinson's disease. People with this type of dementia often have problems thinking clearly, making decisions, or paying attention. They also have memory issues, and they start seeing things that aren't really there, known as visual hallucinations. Paranoia is also a major symptom of this type of dementia. They may have unusual sleepiness during the day, periods of blanking out or staring into space. And with the Parkinson's type disorder, you may start to notice movement disturbances such as trembling, slowness, and trouble walking. Now, I will have to say personally that with Lewy body dementia, one of the first things that I started noticing with my grandmother was the paranoia and the hallucinations. Those kind of started first. She wasn't having a lot of issues with memory per se, but when we finally had to bring her to a nursing home, it was the paranoia and the hallucinations that started taking control over her life. So everything that she heard and everything that she thought she saw started playing in her head, and there was no talking her out of it. That was true and real for her at that time. So just one thing to look out for, one thing that you might be seeing or witnessing with somebody at home too. If this is a major sign and you know that your loved one isn't in end stage, maybe Alzheimer's type dementia, and it's starting kind of early on, then this may be something that you want to ask the doctor about. The next type of dementia is called frontotemporal dementia, or FTD for short. This type develops due to brain cell damage in the front and sides of the brain that are responsible for controlling decision-making, behaviors, emotions, and language. Now, FTD is the most common cause of dementia in people under the age of 60, and it affects as many people as Alzheimer's disease in the 45 to 65 age group. A loved one with FTD may show personality and behavior changes first, along with maybe sudden lacks of inhibitions in personal and social situations. You may also notice that they have trouble coming up with the right words for things when they're trying to speak or have a conversation with you. They may also have movement and balance problems that also go along with some of the other things. So I think you might be beginning to understand or realize that not all dementias first start off with memory problems being the very first thing to look out for. And this FTD type dementia, it doesn't really start out there. You're going to start noticing the problems that I just mentioned way sooner, and they're going to happen when your loved one is a lot younger than maybe you would expect them to be. The last type of dementia is called mixed dementia, which is exactly what it sounds like. It means you suffer from more than one type. Alzheimer's and vascular dementia, the first two types that I touched base on, those are the most common pair, but they don't have to be. So if you suspect your loved one may be showing signs of any of these types of dementia, talk to their doctor and get support from your family and friends. If you already know your loved one has dementia, then stay tuned because I will be posting tons of videos that can provide activities you can use at home to exercise or stimulate the brain, which will help to slow the progression of the disease. I will also provide more training and give you different techniques and approaches when it comes to taking care of a loved one with dementia. Keep your heads up, caregivers. You're doing a great job. I will post a new video every other week. Also, don't forget the cryptogram attachment, a brain teaser for you or your loved one to solve. These puzzles work by substituting the letters I've provided and trying to figure out the others. Each letter you solve for is the same across the puzzle. It takes some guesswork, but it's fun. If you like this information, don't forget to subscribe to my channel down below and select the little bell for notifications. Until next time, good luck cracking the code.